Hello, I am Dr. Amoneeta. I'm going to talk about cognitive behavioral self-therapy for dealing with pandemics. There are many common reactions to a pandemic. You're likely to feel some confusion. You might have difficulty making decisions, frustration that could lead to anger, and even self-harm. Might have behaviors such as problematic substance use. A big one is fear and anxiety related to the pandemic. Those worries could lead to sleep problems. You might even experience suicidal and homicidal thoughts. Might lack motivation at times. Might experience sadness that could lead to a deeper depression. Might have eating disorders or issues. Might socially isolate yourself and experience obsessions and compulsions related to the pandemic. Again, these are all very common occurrences. Luckily, there is cognitive behavioral self-therapy that can come to the rescue. But wait, you might ask, what is cognitive behavioral self-therapy? Well, let's break it down. Cognitive behavioral therapy, also known as CBT abbreviated, it's a scientifically based treatment regimen that has been used to treat a lot of the aforementioned symptoms quite effectively. This is a tool that you could use to kind of deal with both big and small situational life challenges. It could help you feel better when the circumstances around you are not ideal. And most certainly, living through a pandemic is not ideal. So the cognitive aspect of CBT, these are those mental processes going on in your brain. Things like thinking, learning, problem solving, paying attention, reasoning, and remembering. The first one is the most important that we'll be referring mostly to, which are the thoughts, the thinking. An example you might experience during the pandemic is, I don't want to get this virus, and I don't want to get sick. That would be an example thought. The behavioral aspect, these are those behaviors or actual actions and activities that you do. They're oftentimes related to the previous mentioned thoughts. An example, again, related to a pandemic, would be those actions that you take to avoid getting sick. Actions such as washing your hands and keeping distance from other people. So the T of CBT stands for therapy. This is that psychological or emotional treatment that's used to improve your mental well-being. There tends to be a focus on the thoughts, the cognitions, and the behaviors in response to your circumstances. It does not necessarily have to mean in that more traditional sense of the word therapy, such as talking with a therapist on a couch or in an office. Rather, it can be something that you can do independently on your own. Even traditional talk cognitive behavior therapy, which uses a therapist, has the end goal of teaching you to do the techniques on your own. Hence, self-therapy, which is what we're going to talk about. A couple of basic, easy techniques that you can do yourself to try to improve your psychological and emotional well-being by changing those thoughts and behaviors in response to the circumstances in productive and healthy ways. So let's focus then on the thoughts and the beliefs. So much of a pandemic first is out of our control. Many things we cannot control about the circumstances. That is a fact. But something that we often don't realize is that we do have some control over our thoughts and beliefs in regard to our circumstances. And of course, those thoughts and beliefs can then in turn influence how we feel. And of course, how we feel can then influence how we act. So you can see that there is a relationship between the cognitions, the thoughts and the beliefs, and the behaviors, how we act. Therefore, those thoughts and beliefs really do tend to shape our experience. Extreme and unrealistic thoughts and beliefs, they can oftentimes equate to uncomfortable feelings and unhelpful feelings, also uncomfortable and unhelpful behaviors. So therefore, let's examine some of the less productive and helpful thoughts called negative automatic thoughts, abbreviated as NATs. Much like those annoying gnats, those little insects that tend to fly around your head, NATs, negative automatic thoughts, fly around inside your head. And of course, they are equally as annoying as the little gnat insects. So in order to combat these gnats, we need to be a detective. We need to be able to swat those little annoying gnats out of our heads. The first step then is to notice your gnats. Raise your awareness, pay attention to them. Step two is to start to be that detective and ask questions like, are you true? Are you realistic? Do you have evidence to prove that? Is there an alternative explanation? Then rewrite your gnats more realistically. That's what I want to teach you next, is to do that rewriting. And let's use a pandemic example. One of those quick automatic thoughts that lots of people might get and might repeat frequently is, I will get this disease and die, or something similar. Now, how do you feel after thinking a thought like, I will get this disease and die? Well, if you're like me, you're very likely to feel scared, sad, and anxious, among many other common emotions. Then, if you're feeling that way, what does that make you want to do? Again, like most of us, you might never want to leave your home again. Is that helpful? Well, that doesn't sound like much of a life to live. So if not helpful, can you think of a way to change this thought? Well, you might think of a way to positively reframe it, kind of positive thinking. You might say something like, I will never get this disease and I will not die. Now, how do you feel after thinking that? I will never get this disease. Well, likely feeling a bit better. Then what might you do if you're feeling a bit better and confident you will not get the disease? Well, you may not take certain safety precautions that are within your control, which could then kind of put you at more risk of contracting the disease. So such positive thinking seems to be as equally unhelpful as the negative thinking that we saw before. So what's wrong with these two ways of thinking? You probably guessed that they are both too extreme. They're not necessarily rational, nor are they realistic ways of thinking. Can you think of a more balanced way then to phrase this thought. Well, let's look at a way of balancing this thinking. You might say something along the lines of, I might get the disease, but I can also get treatment and I will have a chance of living. That might be a bit more realistic and a bit more balanced. You might ask then, is this statement accurate? Well, certainly it seems to be more accurate than the previous two. After thinking this thought, how do you feel? Hopefully, a bit less anxious, sad, and scared. Now, what are you likely to do if you're not feeling as anxious, sad, and scared? Well, again, hopefully, you would still kind of live your life, do your responsibilities, continue functioning, while at the same time taking certain precautions that are within your control to try to maintain your safety and reduce your risk. So, in sum, learning some basic cognitive behavioral self therapy techniques can help you change your beliefs and thoughts about the uncontrollable conditions of a pandemic. You want to recognize negative automatic thoughts and you want to change them to more balanced thoughts. Having more control over thoughts, therefore, can help you feel and behave in ways that are more productive and are better for your well being. Thank you very much.